All right. Good afternoon, everyone. Thanks for tuning in. Very excited to have Christian on again from ATAI Life Sciences. Christian, thank you so much for joining us today.
Thanks for having me. Always a pleasure, especially in those exciting times.
Awesome. How was your weekend? Where are you spending your time these days?
I'm spending my time, actually, I'm at the moment in my new home in Lugano. I don't want to show around because there is a little bit of chaos because as you might see on the shelves, there is nothing. So I just got the furniture literally 3-4 days ago. So
wow,
settling in Lugano, but going to New York tomorrow. So I'm spending my time between New York, London, and primary residence in Switzerland.
Nice. That sounds good. Well, so let's do this. If it's
on the lake and the mountains, so
we're gonna have to turn that camera around and see it.
I can. Let's do that. Here, can you see it?
Oh yeah, it's beautiful out there. That is awesome. Very cool.
It's very good for mental health.
I bet that's awesome.
So right at the topic.
Let's do like a 1-2 minute executive summary for people who don't know who you are. Will you give everyone your background and sort of get us right up to your investing in psychedelic space?
My name is Christian Angermayer. I'm running my own investment firm, which is primarily my own capital. Started, I always feel so old when I say that, 27 years ago, actually in biotech, starting a company, which is now called, co-starting it, all credits to my two professors back then, but which is now called Alnylam, which is became a very big and iconic biotech company. And so we have a very broad mandate at AdvisorShares. We do biotech a lot with a focus on mental health. We also do crypto, tech, and hospitality. But then ATAI, which I would say is it's my favorite portfolio company, more than a portfolio company, because once in a while we still start companies ourselves. So at ATAI, I had the idea of bringing psychedelics back. I'm the founder, I'm the chairman. As I said, meaning not just because the time is really right for psychedelics, but also because it's really a very valuable and good endeavor. I'm very proud of that we're doing that.
Good. Is that what ultimately got you to investing in psychedelics, sort of about the mission more than anything else?
For sure. I'm always a little bit cockily saying, because as I said, we're not just investing in psychedelics. I'm the founder of ATAI, and ATAI was the first real psychedelics company, especially when we were still private. So I would say, again, and I say it a little bit cockily, but I'm saying it because I'm so proud of it, not because I want to sort of, I don't know what's the English term, show off, but I'm really proud that my colleagues and I, and this goes, by the way, back to 2014 when I started thinking about how to bring psychedelics back, that we really were the pioneers in this medical renaissance of psychedelics. There are many great other people who have sort of evangelized and driven the psychedelic renaissance over the last 20 years. But I think the huge contribution we at ATAI did, and by the way, there I include Compass, which was kind of spin out of ATAI, was that in 2014, so way before the actual foundation, I started thinking about it because I think these substances should be back in our society as medical treatment. By the way, at the very beginning, I was thinking maybe I should do it politically, maybe I should do it like cannabis, whatever. But then over the years, so between 2014 and 17, my sort of conviction formed that the only way to bring back psychedelics in the given framework of society, we can always dream how would a society look like if I could draw it from scratch, but in a given society, in a given medical system, I came to the conclusion that the only way for now to bring back psychedelics is in a medical, regulated, and strictly science and evidence-based way, which only is, by the way, doing it doable for profit with companies, because we have already, I think in total, Compass and ATAI together raised more than $1 billion. And over the years, we're going to raise more to commercialize all of these products. And obviously our investors who are tuning in now, they want to have a return on that. So that's why I decided the only way, as I said, my first conviction was the only way to do it is in a sort of medical way. And then based on that, because medical way means you need to do all the clinical trials, whatever, the only way to do it in a medical way is in a for-profit way. And that led actually to the start of ATAI and Compass, which, as I said, were the very first two professional psychedelic medicine companies. So long story, but like I always want to say here, like please, like more than an investor, like I would say really the driving force, hopefully with my colleagues together.
Terrific. And so before we get into some of the things that are going on specifically with ATAI, we've been in the psychedelics investing space now for several years. It's been a volatile space. However, this year has been spectacular. It's been nice to see the rebound at a high level. What are you attributing stock movement, interest in general, the focus on the industry to?
Let's maybe first, for 1 second, why psychedelic stocks went down. Okay. There were actually two reasons. The one was like biotech is in a very shitty state still. And I'm actually happy that now kind of psychedelics leading the way out, but like the last 3 years, and we have a broad biotech portfolio aside of ATAI, like biotech was awful. Yeah. And again, they're the main reason. I'm simplifying to not talk too much, to spend too much time on it, but like the main reason, there were many more, but like the main reason were interest rates, because biotech is sort of one of the most interest rate sensitive industries, because like obviously in an NPV calculation, you use a discounted interest rate and DCF method. Yeah. And in biotech, especially, the cash flows are normally at least further out. They are very early stage one where it's way out. Yeah, they're especially ATAI, by the way. It's very short term because we're going to be with our products in market soon. But in any case, they are somewhere in the future. So the higher the discount rate, the worse for the stock. So biotech as a sector sort of got hit the hardest and has not recovered yet as a sector, because it will just recover when interest rates go down. This is, by the way, side note, not only for psychedelics, but I do believe that biotech is the most interesting sector to invest right now, because it's the one sector who hasn't recovered, while Bitcoin did already, whatever, and interest rates will go down. Yeah, I'm very convinced of that. And that will sort of, I think, lead a broader biotech recovery. So in this down sector, psychedelic stocks originally, changed now, but like originally did worse than the normal biotech stocks for several reasons. In downturns, investors don't like novelty. And we are novel, and I'm actually proud of it that we're novel and we really have paradigm changing treatments for the benefit of patients. But like investors in these days are in a down days, they're like, oh shit, I want to give me a normal cardiovascular drug, whatever. I don't want to talk about psychedelics right now. Second, a little bit was also a tiny bit a sort of self-made, at least industry, if you want to call it an industry problem. Because I would always claim, and your index, I think your ETF has sort of positively shrunk in terms of numbers of companies, because there was so much bullshit. I always tell the story. I had so many listed companies calling me and pitching me business models which were clearly violating my patents. So I was like, you need to invest in your company, although everything you tell me is kind of bullshit, because like you don't have anything. Because I want to remind everybody on this call, like if you look at companies, by the way, in general, but like you wouldn't think about that in other sectors, or you would say it's very normal. But in psychedelics, people kind of feel like, patents are not needed. They are. Like what I can say, ATAI and Compass together own most of what I would deem what is medically and commercially viable in the treatment space. And we can talk about that. What does medically and commercially viable mean? But long story short, there was a lot of bullshit out there, and that confused investors even more. They were anyway risk averse, and then they were like, well, there is at the height in 2021, there were, I think, more than 150 companies listed who said they're doing something with psychedelics. The truth is there are maybe 4 companies I can see listed, and maybe 1 or 2 private ones who really have, again, patents so that they own what they're working on. And that's, I think, the capitalistic sort of basis 101. You need to own, like, by the way, because you could start a company tomorrow, Noah, and you could say, I'm researching psilocybin as well. I couldn't stop you till you become commercial, but you could never make money with it. Science is always allowed. That was one of the loopholes, which you think about it is absurd, because I think it's kind of fraud, where companies tricked people and said, oh, we're working with psilocybin. I was like, then people called me, oh, this company works with psilocybin. Don't you own it? I was like, well, they can do research as much as they want. They can never become commercial if they hit our patent. So anyway, and that sort of added on. That's why for a long time, that's the past, psychedelics underperformed stocks in general. So now what happened? The market has cleaned up. Yeah. So there is more and more, or less and less sort of stocks which people really would define sort of the psychedelic universe. And that's good, because I think there is really just, like, as I said, a handful maybe companies who have both the commercial and the sort of scientific basis to somewhere become a company with an approved medication and you make money with it. But then also biotech is kind of starting to come back. Yeah. But then the most important thing is that, and there I'm very proud that both Compass and ATAI had really good data, late stage data, by the way, also really profound data, because there was a lot of competitors of us, which I wouldn't even call competitors because most of them don't have patents. But if they did something, they did like small number studies. 10 patients here, 20 patients there. Like, that will not lead you as a company to an FDA approved product.
Right.
And what we delivered, we meaning Compass, which with its phase 3, the first phase 3 readout for psilocybin, and especially ATAI Beckley, which we just bought Beckley for 5-MeO-DMT, BPL-003, was really like gold standard clinical trials with like hundreds of people, placebo controlled, obviously, international, like US and abroad, whatever, like really like, and we always said that we want to do the gold standard and rather spending, and my heart is bleeding as an entrepreneur, but in this case, I was saying like, let's rather spend a little bit more than a little bit less. And these two data sets, which are really like, in a good meaning, like you would expect it from any other biotech company, because that's what I always said, like, yes, we're special. Hopefully people really realize I have this huge passion and belief in psychedelics, but because I have this belief, we want to be a normal biotech company when it comes to how do we structure trials, how do we do data, whatever, because I don't want any exemption from anybody, because they're so good. It's so easy to prove that they are much better than all the stuff which is out there. Yeah, but we want to do it like in a very traditional sort of FDA framework. And these two data sets were the first one ever in psychedelics, late stage, which fulfilled that criteria in my eyes, but more importantly, in the eyes of investors and the regulators. So suddenly investors, regulators, by the way, and pharma companies were like, wow, now we're talking. Yeah, now we're sort of getting really close to real medical drugs being approved, making revenues. Yeah, and that's kind of changed the whole perception. And then lastly, sorry for my monologue, we got a lot of support verbally by the FDA and by the HHS, Human Health and Services. Not saying, by the way, it's very important that the FDA had not been supportive before. They always were. Right. They were a little bit this unfortunate misperception because there was a really like sort of, I won't say bad actor, but like non-qualified actor, yeah, who had like MDMA data, let's not name it, yeah. And it was just like a bad executed trial. And they tried to blame it on the FDA, which is a bad form, but also which kind of made some people think, maybe the FDA is not supportive. So very clear is the FDA has always been very supportive to us. The only thing they said, which is by the way very fair, do it in a proper sort of gold standard way. But now under the new administration, the FDA and HHS and even other parts of the administration are outspokenly supportive, which is helping because it takes that sort of fear away from for investors and pharma. Could that be like that they are not supportive? They fully are, but now they're saying it.
And I guess it makes sense, getting approval at the FDA level is probably, exactly where you want to be, though it does seem like we're seeing, the right word might not be approvals, but some flexibility at a state level, right? The state of Texas just announced research around ibogaine and looking at that relative to veteran use. These states that are loosening their restrictions around, psychedelic-based medicine, is that as helpful, or it's really the focus is at a national FDA level?
It really depends what it is. So you mentioned the very good one, which is the Texas initiative for ibogaine, because they're giving research and support. So they're investing. That's great. Yeah. There are some other states who tried to sort of be very quick and sort of kind of decriminalized it, that at best is neutral. It has even a risk, so I don't like it to do harm. Why? First, we always need to remind ourselves, like speaking as the non-American, how the US system works. And people, at least the majority of people, need these medicines to be paid by the healthcare insurance. And what is very sad is that mostly the rich people are pushing for decriminalization because they can afford their own shamans. They can afford all of that. Yeah, right. It's not the 60-year-old woman in Iowa who will say, oh, I fly to Oregon and like pay my own shaman and grow my own mushrooms. It's not going to happen. Yeah. So our focus was always first the people who really need it, which is, by the way, the biggest group of patients in the US by far. It's like 5-6 times more people suffer from mental health issues than cancer, than anything else, than cardiovascular issues. Like, it's the number one group of patients. And we wanted, again, I can always repeat myself, but it's so important, we wanted to be approved medications on a federal level, by the FDA, and hence being paid by insurance companies. So why I'm saying at best these state initiatives are neutral is, again, they don't lead to payers doing it. They don't lead to approvals, whatever. And if people abuse it and sort of do it, let's say, wrong with a harm to whoever does it, we live, unfortunately, in a media world that's going to create headlines. It's sad. Yeah. Look at what happened with ketamine. Very unjustified. Ketamine, right. Spravato, is a very, very good medical drug if done under supervision with a therapist together. Yeah. Right. There are some loose companies who send it around. Matthew Perry did ketamine, and went in a pool. Right. So the headline, though, in the media was not, oh, Matthew Perry died drowned in a pool because he was having ketamine. The headline was he died of ketamine. I got so many emails where like people are, oh, Christian, you always say ketamine has no toxicity. It doesn't if you do it with a therapist. But while on ketamine, by the way, same for any other psychedelic, you could create an accident if you're not properly supervised. By the way, the counter argument would be like, oh, alcohol, people drive drunk. True, but unfortunately, the media will always go against the novelty. Like in 10 years from now, this might be different. So people say, oh, why are you so strict? And I'm like, no, I'm not. Like, actually, but I want to start where really people need it. And that's the patients. If then in 5 and 10 years from now, things are decriminalized and people do it recreationally, look, who am I to judge? Yeah, I'm doing it in a country where it's legal. But that's the next step. And that's sort of the icing on the cake, but we should not do anything now as society which harms that there are like 80 million people or more who really need it right now as soon as possible because they have no other option.
That's good. Thank you for that. And hey, I wanted to jump back when you were talking about sort of the intellectual property rights and things like that. You know, I'm definitely familiar with that in the psychedelic space, but I have to admit, when I think about the space today, I think about it in terms of, you know, the trials and the testing and the moving towards approvals. Is the, you know, intellectual property aspect of things still a big, important growth area in the psychedelic space, or do you feel like you've sort of captured what you need on the IP side and now it's really trying to commercialize what you own, or do you push aggressively on both sides?
We push aggressively on both sides. Like there is the more the merrier. And what is also the case, there are still listed companies out there, which at least from my sort of ability to judge, which I think is quite good because I know the sector I know is will never be commercial for many reasons. And I think there is still a little bit of work through this, if you want to call it, the sector has to do till investors realize, okay, you need to have your patents and who really has them. So by the way, sorry, I was just looking at what's popping up here. Another thing is like there's two things. One is the patents, and the other thing, again, coming back to what I said before, the commercial aspect. So what we want, at least as ATAI, but I think everybody, every investor, whatever, we want these medications to be approved, paid by the healthcare insurance. But if in the moment you say that, there is a third thing you automatically, implicitly saying is like, duration matters. Because again, that's an enormous part of the costs for these treatments, because they have to be taken with a therapist, is how long do they take? And the very short version is the shorter the better. That's, by the way, why people maybe especially and got way more excited about the phase 2b data from ATAI's 5-MeO-DMT than Compass one, because like at ATAI, we made the conscious decision around about 3 years ago, and very proud, and that actually big shout out to our CEO, Srinivas Rao. It was his sort of push to say we focus on short-acting psychedelics, which is 5-MeO-DMT, which is DMT, and hopefully also R-MDMA, which we're trying to short. Why is that so important? Very simple, because obviously it's way better if the trip or the session from A to Z with preparation, come down, whatever, takes 2 hours, which is what we're targeting, not 6 hours like psilocybin, not 12 hours like LSD. Yeah. So I always say, like, with biggest love for a day on the beach in a country where it's legal. Yeah. I love LSD. Great drug. Yeah. But it's a 12-hour trip, and maybe 14. Yeah. Right. By the way, and think about it, there is so many small things you might not think the first moment is like, that might mean you need 2 nurses, because the shifts of the healthcare professionals are not 12 hours, not talking 14. Right. What is if the trip is even longer? Can you send the people home? Do they need to stay overnight? Where do they stay? Do you need to have a bed in the clinic? There is so many details investors are not thinking about yet, and we do. And by the way, that's maybe the last argument I forgot when you asked me what has changed the last 3 months. What also has changed is that there is one, it's not a real psychedelic, but it's kind of psychedelic-like and psychedelic light, which is called Spravato from Johnson & Johnson. Mm-hmm. And at the beginning, talking now 2019-20, when it was approved, it had a slow start, which if you look back now, it was completely homemade Johnson & Johnson. First of all, it was COVID, so right. Hard time, but also they didn't really know how to handle a psychedelic or psychedelic-like. Yeah, it was a very slow start. And that actually led to a lot of negativity, where analysts and investors said, well, they always said, we do believe you, ATAI and Compass, you're the professional ones, you're gonna get your drugs approved. I would say nobody really doubted that, but a lot of them were like, if I look at Spravato, it's gonna take you then, after you get it approved, years to commercialize it. Right. So now, as I said, there were a lot of homemade problems we're not going to repeat. By the way, sometimes it's better to be the second one and just learn from the mistakes. Right. B, society has moved on positively. Like, psychedelics are much more, we're having this discussion, whatever, are much more accepted already and known and talked about than they were like 5 years ago. Right. But most importantly, there's this saying, I think it's called the pioneers take the arrows and the settlers take the land. Johnson & Johnson has paved the way. They educated all the therapists. They helped building up clinics, whatever. And now that's why, talking my own book, because I'm the founder of ATAI, but why I think we really are in the best spot with our short duration psychedelics. Yeah, now we are coming and fitting exactly into that Spravato sort of paradigm, or a Spravato window of 2 hours. Yeah, and that is actually also what investors are realizing now in pharma, and it's like, wow, not just that these drugs are going to be now approved soon because we have gold standard data, but also, wow, the rollout might go much, much quicker, and a drug like BPL-003, 5-MeO-DMT, might be a multi-billion-dollar drug very, very quickly.
It does seem like when you talk about sort of mainstream people being more familiar with it, it does get more coverage, it seems like, right? The main news channel, CNN. I know on Netflix there was a bit of a documentary, I forget what it was called, about changing your mind. I've even just got through the 2nd season of 9 Perfect Strangers. I don't know if you're watching that series or not.
I was in touch with the crew and the director. I always said, like, I can't fully approve the storyline because
right, it's a bit wild, right?
Is giving it without consent, and we don't want that. However, as you say, all of these things make the society ready and sort of eagerly
normalizes.
Yeah. Exactly.
Yeah, absolutely. Interesting. Well, so let's talk a little bit about what's going on specifically at ATAI. Maybe starting with, I know you said you have a background in crypto investing, but you made some announcements around Bitcoin on the balance sheet, right?
Yeah. Look, it's very simple. It's not even a Thai specific decision.
Sure.
I believe the dollar is going to get devaluated further. Right. So I think it's not even, people make it very special. I think we're kind of maybe 12 months away where the whole world will say, well, it's very normal, because like if you're an international company right now, you normally own US dollar and euro, and nobody would say, oh, that you're owning euro is crazy. You're having a mix of currencies, and maybe, by the way, you're not even holding them on an account. You buy US treasuries. You try to sort of protect actually your cash against devaluation. So, and by the way, especially biotech companies, because they normally not over raise, but you raise a lot because your trials go on for quite a long time. So if I look at ATAI, I need to say in 3 weeks, I think 2 weeks, our quarterly numbers coming, but people can make the math. We had 108 at the beginning of the last quarter when we announced it, and now we raised another 80 million. So let's assume we have something like 180. I don't even know actually the exact number right now, but like something like that, 180 million. Why should I have that lying around for the next years? By the way, this is going to be we're financed. We're fully financed till into 2027. Yeah, this is it's around 2 years. Yeah, so in a prudent mix, I think every company, every treasurer should say, well, it's kind of obvious what's happening in the US. By the way, side note, I think it's the right thing for the US to devaluate the dollar and so on, for your economy. But why would I hold more dollar than I have to? Yeah, and at least sort of adding Bitcoin to the mix is, I think, so it's not speculation, which some people say, oh, it's a very prudent downside protection against what's happening outside ATAI, sort of in the macro world. And I think, as I said, in a year from now, it's going to be very normalized. But I also want to make the point, because I know, and actually I think they're great, but they're so-called crypto treasury companies. That's something completely different. Like, these are companies who really practically have no business model, and it's not bad, but focus practically on Bitcoin. Yeah.
Right.
That's not us. That's very important. Like, for me, it's two different very things, but we are an operational company. Again, I don't think I need to make it more clear how much I believe in psychedelics, but I think for our treasury mix, very prudent, very sort of almost normal, ordinary, I think it makes sense to add Bitcoin. And again, by the way, at the end, what everybody who's listening can count on, I'm the founder. I'm still the largest shareholder. This year alone, I put in $40 million of my own cash.
Wow.
Every single capital increase we did too. I was sort of being the largest investor. So I want to make this work because the world deserves psychedelics. But I also want to make this work because I want to make a lot of money for every single shareholder, and I'm the biggest one of them. Yeah. So I'm thinking every day, what can we do better? And I think that is a tiny bit, because again, we have a big biotech portfolio where I'm like, there are too many CEOs out there at the moment, especially in biotech, who don't own stocks in their company. Not a lot. Yes, then they say, oh, I have options. That doesn't count. For me, it counts if you have taken your own money and put it into something, because that's what every retail shareholder does. If somebody decides to buy ATAI, they take money and put it in ATAI. And I extremely value that, because I'm doing the same. I take cash, and I know the value of cash, and I make the active decision to put it in ATAI. And everybody who does that together with me deserves the best outcome. And sort of thinking about things like how to do a better treasury policy, I think is that. And I think the companies and CEOs who don't do that, they are not conservative, they're lazy. And they maybe don't care as much as I do about shareholder value.
Yep, that makes sense. There's real people. I was clicking on Stevie's comment here. He looks like he picked up some shares this morning.
I don't know if everybody sees that comments, but they're very nice. I'm very appreciative. So I look, not financial advice, but again, as I said, I put in 40 million this year. I really think this is the right moment today, like this week, like this month, like this time now to go back in psychedelic stocks. Everything is like, The last year was stressful. I'm very sorry I tell it everybody but I put in money in the IPO and I never sold any stock. I put in every single round. Yeah, the last years were hard for ATAI, yeah, for share price wise and for biotech. But for me, it feels at the moment everything is coming together. The biotech as a whole is recovering. Yeah, we had amazing data. There's pharma interest. I didn't mention that. Sorry, there's so much to talk about. We had a pharma company taking a strategic stake, Ferring, and they might want to increase. There is the political support. There's the patients in need. There's literally everything is, I think, at the moment coming together in a positive way for psychedelics in general, but especially for ATAI.
Well, and so what's going on at a psychedelics and at a high level that's got you the most excited in the near term?
So I think, let me phrase it sort of with all the disclaimers, but I think the Compass data, I know some people were a tiny bit disappointed because the difference between placebo and active group was not as high as expected, but very simple, it was enough. They're gonna get approved.
Okay.
And I think that's gonna move quicker because the administration really wants psychedelics to be seen, and I think there will be a very positive. So now Compass already has paid for 2 phase 3 trials. I can actually see, at least as one potential possibility, how the FDA can sort of ease and speed up trials, that if you have the quality of data we have for 5-MeO-DMT, that maybe we can get to approval for 5-MeO-DMT with just 1 phase 3 trial, which would be a huge lot of both time win, but also we would spend obviously much less. But I think you need, that's why I want to say that again, because I think there is so much kind of still, how do I phrase it nicely, but so much like sub quality out there in other psychedelic stuff. You need a proper phase 2B and not like not a woo-woo one. Yeah. But I think that could be like a sort of surprise, positive surprise, even beyond already a chatter, like how quick, for example, 5-MeO-DMT and psilocybin can be then really approved for patients.
Okay, that sounds good. Well, so I'm going to jump in some of these comments. I'm always nervous about the questions in here.
No, anything. I'm like this guy, like you can ask me anything. There is no, I always, when people ask me before, what can I ask? I was like, I don't care. It should be fun, entertaining, and informative. So ask me anything.
I only worry just, you're a public company. So if I ask a question that maybe you
I
can't directly respond to.
Answer it, but
right. Perfect. So definitely I've seen a couple of questions about the BPL 003 trials. So questions there, what's the next steps?
So the next step is phase 3 trial. And I'm very confident we can initiate that next year. We're doing it really ASAP. Again, everything is aligned. Patients deserve it. It's going to be done very quickly.
Okay. And someone's asking about the same thing. Maybe someone has a patent that's around that. Does that sound familiar?
It's very much the opposite. We do have the patent in the US.
Okay, yeah. Perfect.
It's one of these things where, again, the company was mentioned. I don't see how there is a way around our patents.
Sounds good. Here's a question on the development of, speaking of Ibogaine earlier, IV Ibogaine.
Yes, that's a very good one. By the way, I hope we have time. I have as much time as you have. Sure. So Ibogaine is a little bit longer. So yes, the short version is yes, we're fully on it. We have the patents around Ibogaine as well, which is a very much talked about psychedelic. Different than any other psychedelic, Ibogaine has a little bit of a real medical downside because it creates cardiac, or it can potentially, in some people, can create cardiac problems. So that's why we walked it slower than the super easy wins. Like if you look at the data coming back to 5-MeO-DMT, no zero adverse side effects. Like that is like the best thing you can have. Huge effect, yeah, 0 adverse side effects. The same I expect, by the way, very short in the future, like in the first quarter next year, so just 9 months behind 5-MeO-DMT, we're gonna have the same quality of data set for DMT. And then a little bit behind that, we're going to come with a novel, fully patent-protected version of MDA, or MDMA. So these are the three ones where I expect the same, or the two ones, because for 5-MeO we have proven it, very low, very benign side effect profile and massive upside. Ibogaine is different. We have seen sort of cardiac issues, which, by the way, doesn't need to be a problem, because what does Ibogaine do? Ibogaine is the strongest anti-addiction psychedelic, where in anecdotal and very early trials, we have seen like 80-90% success rate with opioid addiction, which is unheard of. So, and by the way, there is many drugs out there. Take chemotherapy. Chemotherapy has a lot of side effects, but if you have cancer, you're going to take them. So if you're opioid addict, I think, I don't want to say the wrong number, but I think 1/3 of people who are opioid addict over the course, someone unfortunately pass away because of that. So using a drug in clinical setting, which has a little bit of a cardiac risk, is maybe very justified. I'm just saying it's not as of a simple home run than the other three are. But having said that, and my colleagues, if they're watching, will laugh, because like I'm saying that in any board meeting and every session where we talk every day, like it's like Ibogaine is my favorite, because opioid addiction is such a devastating problem, especially in the US, and it's ripping the society apart. So we actually working on sort of fast speeding them up so that it's catching up to the other three. So for our 4 really main programs include as a 4th one Ibogaine.
Good, terrific. Thank you for that. Someone's asking about, I guess, this concept of big pharma sort of acquiring psychedelics-based medicine and then sort of burying it so they don't have to compete with it. They're asking, does the current administration help minimize that environment or that effect at all?
I never, because like what is implicit in that question is that there is sort of a big pharma conspiracy that they kind of acquiring things and then bury them. First of all, by the way, great. And okay, I don't think it's really true ever, because I think a lot of things, if I say it harshly about big pharma, where people interpret it, oh, they acquired something and buried them, is that they kind of were just like incompetent. Yeah. And then it looks like, by the way, that's my fun joke, like not joke, even like I know many people, like, because I'm also very active in politics. And I always say, like, if people attribute too many conspiracy theories, it's almost giving people in power too much credit. They're not that smart. And the same for big pharma. You give them a lot of credit they just sometimes very incompetent. And that, I don't want to be too funny about a very serious thing, because that incompetence sometimes then leads to drugs not getting developed. There's corporate politics, there is budgets, whatever. So I don't think that is a risk in general. But like it's even lesser a risk in psychedelics, because if it were a risk, then it would just make sense for big pharma if they would have money-making machines, which we would take out of the market. They don't, because all the patents for the shitty products on the market, for the benzos, for the SSRIs, most of them are off patent. It's the opposite. Big pharma, I think, with that data set is sitting there and is like, we need that. Yeah. The question is, do we need them? And not necessarily. But there is forms of partnership, by the way. We don't want to rule it out, because like, but I think I want to say positively, and like, again, thinking about compliance stuff, like, I think we're in an extremely strong position as ATAI for like 3 reasons. Again, I can always come back. We have amazing data, and we have exactly what works patent-wise and what works commercially. Check. Second, we have a lot of cash because we just raised. And even more, we have now 2 anchor shareholders with myself. From the beginning, I always said, if ATAI needs money, I can put it in, which is a very rare thing that biotech companies can say that. And now we have with Ferring, another very passionate investor and shareholder, which is, by the way, big pharma, but is very like gentle big pharma. And they're like, hey, we want to be your partner. We want to be your shareholder. Whenever you need us, we're there. And I think that gives us all the strength and freedom. If another pharma company wants to work with us, we're going to talk, because as I said before, I have 2 objectives. I want to bring these medications to market as quickly as possible, because patients deserves it. And second, I want to make money for our shareholders because they deserve it, because they entrusted us with their investment. And we're in a very strong position to maximize both of these objectives.
Nice. I like it. I like it. Let me see if I can jump to a couple of more. I don't know that I'll be...
I want to see the ATAI percentage in your index funds go up a little bit the next days.
I do too. That's awesome. Here's someone asking for better acceptance in Germany. What's the German market like for psychedelics?
Look, it's not. America is at the forefront, positively said. I know, like, meaning I'm German, so when I give interviews, it's also changing. Germany is a little bit behind. Germany is very conservative. Like, they're gonna get around. They're gonna get around.
Yeah. Here's always a tough question for people sometimes. Besides ATAI, who else do you like out there in the psychedelic space?
Meaning, I do like Compass. We still have a stake in them.
Yep.
I like, and I'm not. I hopefully like I would really like say it differently. Like I would say maybe I would try to hide it then, but like I really think if I look objectively on ATAI, we are sort of the best pick. Not just because I'm sitting here and representing it and I'm the founder, but like sort of I think we really thoroughly thought it through. As I said, what does work commercially? How do we have the patents? So I think saying that very like again with all the bias I have as the founder, I think ATAI is in a different class of its own. Yeah.
Okay.
So I would say number 2 is Compass. They have their struggles, not because psilocybin isn't great, but because it's a 6-hour trip. Yeah. Yep. And why would people do a 6-hour trip? And again, patients is a different question. Why would payers pay a 6-hour trip with all the costs around if they can have the same? That's what we've shown in a 2-hour trip. Yeah. So again, do I like psilocybin? Yes. Do I see the commercial? I always said it. I said there is like, and if you go back, I'm very consistent since 2017 and especially 2020 when we started getting public. I think this is a market where at the end 1 or 2 companies matter. Yeah, and I think we're definitely the one company that matters. And look, is there niche stuff like we bought some patents here and there for some millions? Is there? But that's not the size we're talking now. ATAI is now $1 billion company, and yeah. So it's really hard to say, and not because I want to be mean, or because it's like again, it's very like factually like where are the patents? Where's the commercial viability? Yeah, where's the data? These are the 3 questions which matter, or the 3 things which matter.
Yep. No, that makes sense. And then I meant to ask you a question about that whole sort of, the treatment time frame. Is there a trade-off on that? If you're able to cut the time frame down, do I need to come back more frequently, or are you just trying to cut the time frame down with no trade-offs?
So the data. So first of all, we don't cut it down. That's different. That would be like if you say, I don't believe in that. There are trip stoppers. Like I don't believe in that. I think a trip is. Now we're jumping it's not a scientific answer I'm giving, but I think spiritually a trip is a given kind of almost like course, like a class you have to visit, and you need to do it from A to Z. But whatever it's designed by whoever, again, people who saw other podcasts, we're here now in a very stock market focused one, but my personal conviction is that these drugs are very spiritual and very sort of given by us from God, and he seems to have designed it in a very specific way. So I think you can't stop them in between, but what we have proven scientifically is that in the core, like a 30-minute, 45-minute experience, by the way, which is just what it is, like with 5-MeO-DMT, yields exactly the same, if not better, outcome than a 6-hour psilocybin experience.
I like it. Thank you. Here's a question that I'm going to change up a little bit. They're asking about your favorite private companies, but I'd really change the question more, and you're welcome to name anyone, but you're a public company. Do you think it's easier to operate as a public company or as a private company? I mean, what you guys are trying to do is obviously very difficult. What the industry is trying to do is difficult. Is there a better path to operate under, or not really?
There is no real yes or no or better, because like I always think, so being public is not what's the English term? there's no reason to be public just for being public. Yeah, you have to use it to the benefit of the companies, the shareholders, the patients. So, and there are times when, look, in the last 3 years, it was very painful when I saw my own share price and my own portfolio going down, and I was thinking, what do people think when they look at ATAI? Whereas it's painful to be public, but then there's other times where it's helpful. So there's no right or wrong. It's really like, what's your objective? In which do you want to get sold? Do you want to run a partner? Whatever. So I think there are, but I can't name them, by the way, because we do have a further appetite where it makes sense to acquire small bits here and there. I mean, we did acquire Beckley. Like, if we would have the same podcast like 6 months ago, I would have said, yes, there is an amazing company called Beckley, which we already own 35% of. We invested the first time in January 2024, and they are amazing. By the way, they have, as is the question before, they do have the patents on 5-MeO-DMT. They are I think the only ones, because, by the way, smoking, let me tell you one thing, like, if anybody again compares us with the other company who does 5-MeO-DMT, I would like you to host, Noah. You would be perfect, because that company is in your ETF.
All right.
And we meet up in the Netherlands where it's allowed.
Nice.
And I'm going to take 5-MeO-DMT, our version, which is a nasal spray, and I want the other CEO to try his product.
Nice.
I know who's going to chicken out.
Yep.
It's not me. So what I'm saying is,
I love it.
Because that is maybe even a nuance, and I come back to private companies we haven't discussed. It's not just patents and commercial. Delivery is also important. And by the way, IV reduces, for example, the number of doctors and healthcare providers who are allowed to do it significantly. For example, for Ibogaine, which is IV, it's okay because there are dedicated addiction clinics, and it's a smaller group of patients, but with more need, and with a sort of addiction is a very sort of defined infrastructure. But for depression or TRD or MDD, whatever, IV is not going to happen. Meaning, or at least you have so little healthcare providers who can administer it. But the same is like, I don't think inhalation will ever happen. First of all, the FDA is very, very scared, or it's very careful with inhalation, because inhalation is kind of a dirty way to take things. There's many things which can go wrong. And then especially with 5-MeO-DMT, I have seen it recreationally where people tried it, inhalation. By the way, the device this company is using, you can literally use buy at Amazon. I think it's called a bong. Yeah, so not the thing that you want to see in a clinic. And again, I've seen many people who really had severe, like, sort of psychological side effect, because inhalation is very quick onsetting, whatever. So that's why we worked years, or Beckley, on the nasal stuff. This is proprietary formulation, because it's giving a much smoother and better for the patient onset for a very potent drug. The same, by the way, for DMT. There's a lot of chatter who does DMT. Again, it's like, do you have the patents? But also, like, how do you deliver DMT? Yeah, ayahuasca doesn't work. It's two drugs as well. It's because, like, you can't drink it, whatever. IV, complicated. We found a way, with our transmucosal version. And by the way, all of these delivery mechanisms, they adding a lot of patent sort of stack on it. Again, I can always say, with all the passion I have for ATAI, a lot of the things we were working on the last 5 years, which make ATAI unique and very well positioned, you're just going to see when we get a little bit even closer to commercialization. But then people will say, oh, wow, this is why they bought Intelgenex, which was a Canadian listed delivery company. I think we did the investment 2022, 21, but like, then we took them private, whatever. But there are reasons for that. Yeah, you will see when these products are coming closer to markets.
Okay, that sounds good. So
private companies here and there, not a lot, but there are a very small number which I think are very interested, and we are at the right terms always interested in further acquisitions.
All right, awesome. Thank you for that. And I should say there's probably 20 other questions in here I won't be able to get to because we're running out of time, but I did see one. Becky actually had several questions, but this one stands out for me given my age. So she's asking, given the recent findings around anti-aging, do you foresee pursuing longevity via psychedelics?
Look, I personally think this is super exciting because, by the way, I think psychedelics have way more benefits than only mental health. So let's start there. And for pure financial reasons, because all these trials cost money, we started with mental health. It's also kind of, how do I say it with the respect for the patients, like it's the lowest hanging fruit.
Sure.
Because if somebody has treatment-resistant depression, which is the worst form of depression, and we prove that magnitude, we have proven, people are like, okay, check. That's where that's where we are right now. People are like, check. Let's get it approved. I believe there are many more indications, including aging, but neurodegenerative diseases and stuff like that. We have already quietly and silently worked on, created patents, whatever. But it was not the right time to put them front and center, because truth was, like, the last 3 years, if I would have said as the chairman, hey, we do 3 more indications, while I would be very excited, in the past, people would have said, oh, Jesus, like more money needed. Yeah. Right. So now we're changing again. And what I can tell people, we've worked a lot on broadening our also indication portfolio, again, our patents related to new indications. Yeah. And now that the market is coming back, we're going to talk more about it, but also like really work more on it. But that's kind of, I would say, the second wave after mental health, and longevity is definitely one of them.
Terrific. That's fantastic. I probably need to stop there. We're coming at the hour. Christian, this is awesome. Thank you so much for spending time with us. I really appreciate it.
Thanks for having me. Thanks everybody for tuning in. We can do that regularly. There's a lot of news flow coming. I said it before, like we have DMT data in the first quarter, MDMA data. We will have actually this year, we're going to have open label data for 5-MeO DMT. So there's a lot coming, and whenever you want me on, I'm there. Maybe also one shameless self-promotion, like I'm tweeting a lot about psychedelics and the ATAI. Like whoever is watching, follow me on Twitter, like it's C for Christian and then _ and then my name, which you can read here. Same on LinkedIn. These are the 2 main things, Twitter and LinkedIn. And then you're always up to date.
Perfect. Absolutely. Everyone give them a follow. Everyone, thanks for tuning in. Christian, again, we will definitely have you back soon. Just judging by the questions I was seeing in the comments, people are very excited and interested in what you're doing. So again, thanks again for making time. Everyone, thanks for tuning in, and we'll catch everyone tomorrow.
Thank you, Noah. Bye.
Before investing, carefully consider the investment objectives, risks, charges, and expenses found in the prospectus, available at AdvisorShares.com.